Good morning and welcome to the Chamber Business Report. I'm John Phillips, president of the Palm Coast Flagler Regional Chamber of Commerce. The Chamber Business Report is brought to you by Klein Construction, building the future of Flagler County for the past 30 years. Also by Smart Technologies, they make business simple. And Intercoastal Bank of Palm Coast, community banking the way it should be, member FDIC. And finally, Katz and Green, Flagler County's personal injury attorneys since 1996. Greatly appreciate their support in making the Chamber Business Report possible. And we are thrilled to have our guest today, who is with Haven Nexus. Tolu Williams is our guest today. And Tolu, it is wonderful to see you again. Welcome to the Chamber Business Report.
Thank you so much for having me here.
Yeah, let's talk a little bit about your background. And maybe we'll start with a big picture about what is Haven Nexus, and then we'll talk more about your personal background, and we'll circle right back into the practice a little bit more.
Awesome. So Haven Nexus Family Psychiatry is our outpatient psychiatric practice that we started up about a year and a half ago right here in Palm Coast. We created the company out of the need for our community. We saw that there was a high suicide rate in the city of Palm Coast. It was from an article in a news journal that I read back in 2019 that the county of Flagler County had the highest suicide rate compared to other counties all over Florida, including Volusia, Clay County, other counties that are even larger in population density. So this really sparked my concern for my area, because at that time I had been living in this area for at least 10 years. And I was constantly reading the article about people committing suicide, and it was all linked to lack of psychiatric or mental health resource. That's what it boiled down to. And at that time, I had been practicing for close to a decade. Commuting to Orlando, working at other cities, that had lots of services for mental health. So I figure, why don't I bring, what I know here to help my community? It's a community I've lived in long enough, and I want to stay here. So that was the main motivation for us creating Haven Nexus Family Psychiatry. And the name really came from a combination word. Haven is a place of refuge, a place where people can seek asylum, hope, and Nexus is a connection. And at this time, I've formed a lot of connections with our local therapists. So I wanted to be able to have a place where patients can come for help, be in total confidentiality, and a place where they can have hope for their mental health and know that they can get better. This is not the end-all, be-all. Suicide should not be a solution, to anyone's problems. So that's where the combination word really comes from. And we created this. We see patients in office. We're located at 50 Leanne Way, Unit B1, right here in Palm Coast and Belterra Professional Center. We also have virtual availability to see patients through video so that they're in convenience of their home. What we want to do is eradicate any type of trouble or any type of hindrance to quality mental health care.
And even though you're relatively new to the Palm Coast, Flagler County region, you had a practice in Volusia County in Daytona and Port Orange. Is that correct?
No, not at that time. At the time, I had been practicing as a psychiatric nurse practitioner.
Gotcha. Okay.
And working for other psychiatric hospital and psychiatric practices.
So you've been in the industry for quite a while.
Yes.
Yeah, and have a significant amount of experience. And I know this is a much-needed resource. The mental health issues that we've seen in our society today just seem to be growing more and more by the day, unfortunately. So there is certainly an overwhelming need for services. Let's talk a little bit more about the services that you all provide. In my mind, I'm kind of envisioning it almost as like a hub and spoke, where people come to you to start their journey, and then you might refer them out to someone else for specialized care in a certain area or areas, as the case may be. Maybe let's expand on that a little bit. We were talking before we came on the air about that concept.
Very good question. So at Haven Nexus Family Psychiatry, I am a board-certified family nurse practitioner and psychiatric nurse practitioner. So in the state of Florida, a nurse practitioner can diagnose and treat with medication conditions. So I operate similar to what a psychiatrist can do. So in that case, patient make appointments, just like a regular, I would say like a doctor's office, except my specialty is mental health disorders. They make appointments, and the appointments are usually 1 hour. They come into the office. There's total confidentiality where I take their history. I take into consideration what medications they're on, and we create a treatment plan. Either it's to start them on a medication, which more than half the time people usually knock on our doors because they want help. They've kind of held on for as long as they can with their depression, and at this point they're feeling hopeless, or their anxiety is causing them to not be able to function at work, call out of work, have panic attacks on the job. By this time, they're really wanting medication management, and that's where I come into place. With every treatment plan, it's going to be medication management. That's if the patient wants it. Now, we have other alternatives that are non-medication options, which I can get into. But every treatment plan is always going to come with a cognitive behavioral therapy or any kind of other specific therapy they need. In that case, I will refer out to my nexus of therapists that I've created, that I've networked with over the years. And I will send them to that, but I will do the medication management part. And what we'll do is I'll collaborate with the therapist. We'll share notes as long as the patient has signed release of information for us to do so that we can be on one accord with their mental health. Our goal, for example, I'll have a goal in mind for a patient. I'll ask them, what is your goal? A lot of the times, for being that depression is one of the common things I see, people say, I don't want to be depressed anymore. I don't want to feel hopeless anymore. I want to feel joy. So their goal, they will tell me, is to be in remission. The remission is always the optimal goal. So we create a goal, and the plan is I will continue to see my patients every 2 weeks or every month, depending on the availability, while we tweak. And I will tweak the medication, adjust the medication, or either discontinue them off a medication that they're having a lot of side effects on or they're not responding to, and try other options. But this is all based on we use something called a psychopharmacogenetic testing at our practice. It's pretty much a swab, but there's a test that we do where we take a DNA sample of their in their mouth, and it lets us know. It categorizes every psychiatric medication known to man based on their gene to drug interaction, if this medication will be able to work for this patient, or it's a medication that we should rather stay away from because it's going to cause a lot of side effects.
Yeah, and go ahead, Kelsie.
No, I just was going to say that's amazing. And I noticed I follow you on Facebook, and you do all your rails about the medication that you use. And I noticed that even the medication you're using are different alternatives to the harsh medicine that they might prescribe you at in any other doctor's office. Can you elaborate on that a little bit?
Yeah, so we have a non-medication option. One of the top ones right now that's really making great waves and really changing the life of our patients is a medication called Spravato. It's intranasal spray, and it's actually something we call S-ketamine. So S-ketamine has been FDA approved now since 2019 at least. So this is a medication option that I will bring up, and I'll discuss with my patients about the benefits and also any kind of risk, and see if they're a great candidate for it. It is relatively safe, and in order for a psychiatric practice to offer a medication like Spravato, you have to be RAM certified. The government, the DEA, the FDA highly regulates a medication like this. It is a Schedule III medication, which means it has a high potential for abuse or addiction. So being that Haven Nexus Family Psychiatry, we are a RAM certified facility. We have been approved to be able to offer something like Spravato. And it requires it's a 12-week long program, and that's something I discuss with my patients. And it's really helping for people who've tried at least 2 antidepressants and they haven't found remission from their depression, or they're feeling suicidal. And that's because it works very rapidly. So this is a non-medication option that we offer to our patients at Haven Nexus.
I think one of the other questions that a lot of folks would ask would be, as we're talking about medication and psychiatric care and mental health care, is this covered through most insurances? And that's one of the things where you can expand on that and kind of break down that process. Because a lot of people might be fearful of, if I go to a mental health practitioner, maybe it's not covered by my insurance, so maybe I shouldn't go. Or maybe I choose not to go.
Very good question. So our practice, we are networked with various insurances, including Blue Cross Blue Shield, Cigna, even Florida Medicare. The list goes on. So we are in network with a lot of insurances, and a lot of insurances actually cover Spravato. And in that case, all they really require is for patient, we call it failed trials, when they've tried at least 2 antidepressants that did not work for them. So usually we've been getting patients covered without any issues. So at the least, patient will pay maybe $10 for each time they come. It's a very low and reasonable copay. Most patients, we haven't had any issues with getting Spravato covered at all by insurances.
That's fantastic. Let's talk about, just give some examples. And I know every single patient is going to be treated as an individual because their symptoms and their issues are going to be they're going to vary incredibly. But some of the things that you cover, from ADHD to bipolar, schizophrenia, just to mention some of the broad areas of mental health that your practice covers.
Yeah, so we treat patients as young as 6 years old because my education and training allows me to treat pediatrics as young as 6 years old and across the lifespan. And we treat depression, ADHD, bipolar disorder, anxiety disorders, including social anxiety disorder, health anxiety disorder, OCD, obsessive compulsive disorder, PTSD, post-traumatic stress disorder, any type of behavioral issues with our children, like in school, aggression, trouble, all of these things, that we treat a variety of conditions.
I think this is really educational. I think, as for the vast majority of people in society, when they think of mental health issues, they automatically go to the extremes of the bipolar, schizophrenia, and some of the other anxiety, like say OCD, and especially PTSD in today's society, especially with members of the armed services and members of our law enforcement and first responders who have been through very strenuous, very stressful things. Don't think about that as a mental health disorder. It's just something that happened as part of my job. And you don't get to that. You assume the extremes, but there's a lot of things that lead up to the extremes that your practice covers.
Exactly. I'm glad you brought up PTSD. PTSD is post-traumatic stress disorder, and our first line responders, our firefighters, our policemen, even the people who work, doctors who do medical examination of people who are deceased. Those are the people that are highest risk for it. But really, anyone can experience PTSD. And it has to do with our brain's ability. Our brain has a threshold for how much trauma or how much insults or injury that it can really take. So PTSD is highly subjective. 2 people can endure a similar situation. One can end up with PTSD, while the other one does not end up with PTSD.
Yeah, I think we've seen in today's society, PTSD was almost exclusively, at least in my layperson's mind, almost exclusively associated with the military several years ago. And then it kind of moved into law enforcement. And then it kind of moved into the first responders, whether it be fire or EMS, with car accidents that are very severe and traumatic. And then now into the medical field of ER doctors, ER nurses, ER folks. As you mentioned, folks who work in the coroner's office who deal with death on a daily basis. That can become normal to them because that's their job. But at the same time, as you mentioned, everyone is going to treat that differently. And so that area of PTSD has really broadened, and it's made your services much more needed in our community by a lot more people than what was originally thought, probably.
Yes, and we know something is a disorder when it starts impairing your daily functioning. So you're right. Some people can have it. They walk around. They're happy. They don't feel it. It doesn't bother them. But when something starts impairing your daily function, your ability to be a wife, to be a husband, to be a worker, and to be an employee, to be a business owner, we're talking nightmares about that. Recurrent nightmares. That's a clue that it's becoming an impairment. Another thing is when you're easily triggered by things that remind you of it. It could be a smell. It could be a certain color. It could be the way a person looks. It looks like a lot like that person. So triggers, when you start having triggers, nightmares, there's something called hypervigilance. The hypervigilance, when you're always on guard, when you have this sense of danger, your amygdala, is a certain part of the brain, which is the fear factor center, is activated in PTSD. So when all of these things start to happen, we know that it's time for treatment, when it starts to really become an impairment to your daily life.
I was just going to say, when it impacts your regular life is when it's something to be addressed. So
Now, my question for you would be, is those are the same symptoms that you would look at as far as someone that struggles with anxiety? Because I feel like that's kind of similar there too.
That's a very good question. PTSD is a very complex condition, and if it's not adequately addressed, it can lead to other issues. We're talking nightmare disorder, depression, where you have complete inability to feel joy because you're living in the past. You're stuck in that past, and you can't move forward. If you can't move forward, you're not hopeful. So that's where the depression comes from. And these are the signs I'm looking for when I'm really, evaluating someone for PTSD. We actually use an assessment scale called the PCL-5. And the higher the score, the more severe your symptoms are. So it allows us to really quantify and objectively measure how severe your symptoms are. Yes, those are the symptoms I'm definitely looking for.
we're going to take a short break here, and we've got more time with Tolu Williams, who is with Haven Nexus Psychiatric Care. But you are listening to the Chamber Business Report. We're going to take a very short time out, and we'll be right back with Tolu Williams. Good morning, and welcome back to the Chamber Business Report, brought to you by Klein Construction, Smart Technologies, Intracoastal Bank, and Katz & Green Attorneys. I'm John Phillips. I've got Kelsie Lombard as my co-host.
Good morning.
Good morning. And we've got Tolu Williams with us from Haven Nexus Psychiatry. We've had a great visit, and we're going to get into more details. And Tolu, the first thing I really want to talk about is in the mental health profession, as it's evolved over, especially in recent years, oftentimes people would be stressed, and not do anything about it until they really got to the breaking point. How can we as a society, and we as parents, we as educators, we as friends, we as just human beings help overcome that stigma and get folks to connect with you and your services earlier on before they, kind of reach that breaking point? Because it's not wrong to reach out for help.
Yes.
So how do we do that?
Very, very good question. The thing about reducing the stigma we all have to play a role in it, As, for example, as family members, check on that. There's always that family member you've always been curious, wondering about if they're okay. They're inconsistent. Maybe they'll come to some events. They won't. You won't hear from them for several months.
Mm-hmm.
And I want to challenge all of us to call a family member, that one person that you've been curious about. Check up on them. Ask them, how are you doing? How is your mental health? We want to really normalize the topic of asking about mental health. How are you doing mentally? When we normalize it, when we're able to talk about it more, less people will be afraid to come forward for help. So we can start first within our family, asking family members that, that when we don't talk to that much, call them, give them a call. They will be surprised they even got a call from you. Mm-hmm. So we can start first with that. Also in our schools, whenever we see that a certain student, as teachers, for example, when we see that there's a certain student we're concerned about, go ahead and, talk to administration about it, talk to the parent about it, let them know before things get to the point of us having, deadly shootings. Mm-hmm. If there's anyone you're concerned about, always ask them, how are you doing? And sometimes you don't know, people are struggling and they just want someone to ask them, how are you doing?
Yeah. Someone to show some care.
Yes.
And sometimes there's an expression we hear, and mostly it has to do in the law enforcement world. If you see something, say something.
Yes.
But I think that can carry over into your space as well, especially with our children today. And I know teachers are trained to recognize these things, but oftentimes that can carry over into parents, even coaches of youth sports and things like that. If you see something, say something. Don't be afraid to reach out to someone and see how they're really doing. I mean, we in society have said, "Hey, nice to see you. How you doing?" And we don't listen for the answer. Yes. We just say it.
Or we're just so used to saying, "I'm okay."
Yeah.
I'm okay.
I'm fine.
Yeah.
So we got to get past that stigma.
Yes.
If your arm hurts, your leg hurts, you're going to go to the doctor.
Yeah.
If your head is struggling, and I won't say hurts because it's not a painful thing necessarily, but if your head is struggling, we don't oftentimes reach out for help. Mm-hmm. We just assume, fight through it.
Exactly.
It'll be better. Mm-hmm. And unfortunately, it often tends to spiral downhill. Do you have any, and then this is probably a really tough question. I probably should have asked you off the air before I asked you live. there seems to be so many more challenges with kids today and mental health for young people. What are some things that parents can do to try to help their own kids to be better with their own mental health challenges that they're facing?
Very good question. That's the most faceted question that, I have lots of answers for it. The first way is we got to start being more involved in our children's lives. Know what they're on. And with the social media, which is a big aspect, of where we are right now with our generation, be very involved in what they're doing, who they're talking to, what kind of topics are they talking about. Be very involved and very intentional in being active in your child's life, so that you can always be ahead of things before things happen. Another way is to always ask your child, when they get home from school, how was your day today? Kind of rephrase it, because sometimes they'll just say, how our teenagers are. They say, it was good, it was fine. But really ask them, how really was your day? Being involved in our children's lives, restricting the social media access. You don't want to eliminate it now. You don't want to eliminate it completely, but maybe just weekends is when they can be on social media. Currently, that's what I do for my kids, and it's been working very well.
Yeah.
Working very well.
And I think one of the challenges is it spirals downhill because I'll just focus on kids because that's the portion we're talking about, but this really applies to adults as well. When they are struggling, it's easier to just bury themselves in their iPad or their iPhone and just remove themselves from having to talk to their mom and dad or having to talk to their brother or sister, and they just can get in that spiral, and then you're online too much, and then you do some things and you learn some things and see some things maybe you shouldn't be doing, and then it just goes and goes and goes. And so really to be proactive before you get there is one of the things. And I would be remiss, before we run out of time, we have got to give out your website, Havennexus Psychiatry.com. Havennexuspsychiatry.com. You can also reach Tolu and her staff at 386-247-0840. Again, 386-247-0840. If you'd like to learn more, if you'd like to talk with her, and whether it's for yourself or for a coworker or for your children or even for your aging parents, because that's another part of the market that sometimes we as caregivers for our older parents have to worry about them as well. That's another aspect of the population that needs support from you and your team.
Or just the education aspect. I know your Facebook, you do Rails, and you're educating the people there on what you do, and I think that's important as well. So definitely check her out on Facebook. She has some amazing videos and just getting educated so you can help in the right manner.
And I think that gets people over the stigma to where they can start to get to know you a little bit, and you can tell your story online where there's no pressure. We're not having to sit down across the room from each other. I can just get to know Tolu online and get past that first step. And maybe you do schedule an appointment to come in and have a visit, because she is very, very engaging, very friendly. You will feel like you've known her your whole life. I can say that because I saw you interact with people at our chamber after hours event that we did at Margaritaville at the Chill Bar on the rooftop. Yes. And you just have an amazing way of connecting with people. And so you're in the right business.
Absolutely.
I can tell you that.
Just in the time I've known you, that is who you are, and you wear it in your heart. Is there, and compassion you have for people. So,
yeah. Is there anything that we missed? We got about a minute left in our show. That a question they're like, man, I wish they would have asked me this. Yeah. So now's your chance.
So in our practice, there's going to be advancements. We are going to be including more services. This includes IV ketamine for people who have trialed several antidepressants and have no success in reaching remission from their depression, and people with severe PTSD. So IV ketamine will be something we'll be offering. Also, there's something called PRISM. It's a device for PTSD where it allows our patients to watch an animation and really provocate themselves to triggering scenes. And the whole process is to desensitize them to that. So PRISM is a device that we'll be incorporating. Another service we'll be incorporating is something we call CDE, which is comprehensive diagnostic evaluations for autism. Being an autistic mom of a 6-year-old, I know how hard it was for my son to get evaluated. We had to travel all the way to Orlando for a comprehensive diagnostic evaluation. So as a psychiatric nurse practitioner, I will be I'm trained to include that service. And it's a series of several tests to really see if your child is on the spectrum or not, so that we can know earlier. Early diagnosis will yield early intervention, which is ABA therapy. So these are all the services that we plan to incorporate at Haven Nexus Family Psychiatry.
I think those are amazing services, not only because of what they are, but I think that they're focused on people that have tried everything else and feel like there's nothing for me. And you're really digging deep into finding, no, we have what you need here. So if you ever feel like you're struggling and you're at end's point, make sure you reach out. There is something there for you. So
HavenNexusPsychiatry.com to learn more. Things like psychiatric evaluations, medication management, crisis intervention, and again, treatment for all ages. Tolu, thank you for your time today.
Yes, thank you so much.
The Chamber
Thank you for having
Business
me.
Report is proud to have you with us, proud to have you in our community. And again, we are sponsored by Klein Construction, Smart Technologies, Intercoastal Bank, and also Katz and Green. Enjoy the rest of your Saturday, folks.
thank you.
Thank you.